So, in honor of Pathologist Assistant Day, which is April 14th, I compiled your various questions from the last couple weeks to months and grouped them by topic. I tried my best to keep this short and sweet for the answers, just so that it's not too overwhelming. But if there's anything that you want more information on or have additional questions, feel free to comment and or message me and I will get you the answer. So hopefully this hits all of your questions, and happy PA Day. So there's a lot of questions that I get about the role of pathologist assistants in autopsy. And there's no simple answer to these questions. So some of the questions I get are, can I guarantee that I get an autopsy job after graduation? Or just a simple, like, what is the role of a PA in an autopsy? What is the role of PA in forensic autopsies versus medical autopsies? And what's the difference between the role of a pathologist assistant versus an autopsy technician or diener? So starting with, can you guarantee that you'll get an autopsy job? Now, each pathologist assistant job is going to be a little bit different, and you can really look for what you want, but it just kind of depends on other factors. Like, do you have a specific area in the country that you want to live? In which case, the jobs available may be sort of limited. But if you don't have other limitations and you're really focused on autopsy, you can find a job that is autopsy heavy. Now, most pathologist assistants work in medical autopsies mainly. So there are two main types of autopsies. You can have a medical autopsy, which is traditionally done in a hospital setting when a patient dies in the hospital, versus a forensic autopsy, which is done if a patient dies outside of the hospital or if there is suspicion of anything other than a natural death within a hospital. So forensic autopsies are typically done by forensic pathologists, which are medical examiners, or in a coroner's office. Now, a coroner is an elected official, and so they don't have to be a forensic pathologist, but whoever's performing the autopsy would be a forensic pathologist. So those are separate than medical autopsies done in a hospital setting. So typically, most pathologist assistants work in surgical pathology and can also work in autopsy pathology, in which case they would be doing autopsies in the hospital. Now, there are some pathologist assistants that do work in forensics, although this is not as common. It is becoming a little bit more common as the role of PAs and our scope of practice expands. And so right now there are a lot of PAs that are working on expanding the role of PAs in forensics for a couple different reasons. There's a lot of pathologist assistants and people interested in the profession who would like to go into forensics, but also there's a declining number of pathologists who are interested in or pursuing forensic pathology. And so there's not as many people that are qualified to do this, and pathologist assistants could take up that role. And so there are currently people talking about creating forensic fellowships for pathologist assistants. There are pathologist assistants who already play a role in forensic autopsies, but one of the limiting factors is that the pathologist can serve as an expert witness in court, and currently pathologist assistants do not, and so that is one of the limiting roles or limiting factors in that role. Now, I think in the next couple years, I think the role of the pathologist assistant in forensic autopsy will increase, but there's no definitive answer of how or when that is happening. But there are pathologist assistants who are working with forensic pathologists and various professional associations to increase that role for PAs. Now, other questions I get are, the role of the pathologist assistant in an autopsy. So let's just talk about medical autopsies, since that's the main focus of pathologist assistants currently. So if a PA works in a job where they have a role in autopsy, typically that will also kind of vary. So technically, in school, we are trained to do an autopsy from start to finish, including obtaining the clinical history and the consent, all of the all of the external exam first, then the evisceration, which is the removal of the organs, then all of the sectioning of the organs, and then all of the follow-up of the gross report, so writing like the preliminary anatomic diagnosis and the gross pathology report. And some PAs are even taking on the role of looking at all of the histologic slides as well and helping the pathologist with that final anatomic diagnosis. So it just kind of depends. I know PAs that will only eviscerate if they work at an institution where they have residents, because pathology residents need to get 50 autopsies in order to sit for their board exam. And so if you work at an institution where you have residents, typically the PA will play more of a training role for them. So they will teach the residents how to do the autopsy and what to look for at autopsy. And so a lot of times they will be there more so in a teaching role and to help the residents eviscerate, and then they will help the residents do the sectioning, but they want the residents to get that experience on their own. And so they will play more of a backseat kind of supervising role. I also know PAs who work at institutions where they don't have residents, and so they will do the whole autopsy start to finish. And some of them, like I mentioned, are already looking at slides and working on those final reports. And so it just kind of depends on your institution, and you can tell your employer, I want to do less, I want to do more, and you can try to work on your role with them. But again, it just kind of depends on a lot of other factors and whether you can look for a job that fits your interests or if you have other limiting factors such as location or things like that. So currently PAs, yes, the short answer is yes, PAs do perform autopsies, but typically it is a minimal part of the PA's role. Overall, PAs typically are going to play a larger role in surgical pathology rather than autopsy pathology. And then I wanted to add something else for autopsy. Someone was asking me the difference between a pathologist assistant and an autopsy technician, and I wanted to make sure to include that for them. So an autopsy technician, or sometimes called a diener, that role and that job is a little bit different than the role of a pathologist assistant. So a pathologist assistant will go to PA school and sit for the board of certification exam put on by ASCP. And so they are highly trained in gross dissection and gross analysis of tissues. And so typically at an autopsy, the pathologist assistant would have a bigger role in not only evisceration, but actually sectioning the organs and selectively choosing the sections that need to be submitted for histologic analysis. Whereas an autopsy technician or a diener, there is no specific formal training that is required for an autopsy technician. Typically, in most circumstances, they are going to be trained on the job, and they are typically trained how to eviscerate, meaning they can take out the organs, but typically they will not be able to section and choose the sections for histologic analysis because they aren't trained in that gross identification. Now, of course, there are always exceptions. If somebody is on the job trained and has been doing it for a really long time, they may have gotten more responsibilities, but in general, that is the difference. And so an autopsy technician has less formal training and typically would have less responsibilities and less pay, whereas a pathologist assistant has that formal training and would have more responsibilities and would be paid a higher salary. A very common question or group of questions that I get is about applying to pathologist assistant programs. So my most important piece of advice, I would say, is get experience and understand what the profession entails. You should, at minimum, have some shadowing experience prior to applying to PA programs. Now, I can't speak for any other program or any other, person on an admissions committee. I'm only speaking from my personal opinion right now, but I think that it is very important for you to understand what you're getting yourself into and understand the role of the pathologist assistant. Programs are going to want to see that you understand what the pathologist assistant profession entails when you're applying. And so sometimes it can be challenging to find shadowing, especially if you live in areas that don't have as many pathologist assistants. But I would encourage you to cold call or cold email people at various labs and see if you can find anybody in pathology that you can talk to that can then maybe put you in contact with a pathologist assistant. And if that doesn't work, you can always reach out to any pathologist assistant, and most pathologist assistants would then be more than happy to try to put you in contact with a colleague who maybe lives in your area or maybe knows somebody that lives in your area that could possibly help you out. The pathology world in general is really small, and within the pathology world, the pathologist assistant world is even smaller. So typically everybody knows everybody, or at least knows somebody who knows somebody else. And so there have been people who have asked, to get shadowing experience in various areas, and it's sometimes fairly easy for us to put you in contact with somebody else who may be able to help you out. So never be afraid to ask people for help. Pretty much everybody that I know in pathology, whether it's a pathologist assistant, pathologist, or histotechs or cytotechs or whoever, typically most people, at least that I know, are more than happy to help people interested in pathology and laboratory medicine, because most people in pathology are very passionate about their work and would like to share, especially if somebody's trying to learn more about the various professions. So that would be my number one advice, would be to get some sort of experience. Now, if you're really lucky, you can get a job in a histology or a pathology lab, a paid job where you would be, getting paid for your time and also learning about the job. But sometimes those are hard to come across. And so at minimum, you should at least have some shadowing time. And people ask if they should have shadowing in surgical pathology or autopsy pathology. And while ideally, you could have shadowing in both, I'd say if you could only get one, that surgical pathology is more pertinent. So if you can, try to get that surgical pathology experience in addition to any autopsy that you can get. And don't worry if you can get only one or the other. Any shadowing experience is going to be beneficial for you. Just do your best in trying to find something. Now, if you are trying to apply to PA school, it's not just the shadowing. Of course, there are prerequisite courses, and of course, grades play a role, and there are other aspects to applications. So my other best piece of advice would be to make sure you're reading each of the program's websites and application requirements, because each PA program has a little bit different requirements and prerequisite courses. So each program may have various requirements, and so there's no blanket rule where you have to have all of these classes for every single program. So make sure you do your research. I know that some schools will accept the MCAT, whereas other schools will not accept the MCAT. They will only accept the GRE. Some schools require certain classes, like for example microbiology, whereas other programs may not. And so just make sure you do your research before getting ready to apply, because if you're, let's say, an undergrad right now and you didn't realize you had to take microbiology, you would want to know that up front if you can, rather than trying to have to go back and take additional classes later, or going to submit your application and then realizing you didn't have one of the prerequisite courses. So just make sure you're doing your homework for each of the programs that you're interested in. And then as far as grades and GPA, personally, I think that other parts of an application are more important. But again, this is just my personal opinion. If you have a 4.0, and you took all these really hard classes and you did really well, but you don't have any experience in pathology, or you clearly don't understand what the pathologist assistant profession entails, it doesn't really matter if you have perfect grades if you're not understanding the bigger picture. And so I think that your application should be very well-rounded. So you don't want to just have good grades or just have the shadowing. Try to make it a very well-rounded application, because admissions committees, again, this is my opinion, but admissions committees are going to recognize your experience and your motivation to get that experience. So that, I think, is a very important part of the application as well. And then other things for applying to the PA programs, I get a lot of questions about the job outlook and various job opportunities. So people will ask, do you think the job market will be saturated? What do typical jobs look like for PAs? And one of the best parts about the PA profession is that the jobs are all very different. It's a very wide spectrum of jobs that you can look for and get. So some PAs will want to do only autopsy. Some PAs will want to do only surgical pathology. Some PAs will want to only gross pediatric specimens or GI specimens or breast. And you can find jobs like that. So you can pretty much look for what you want. But again, there are limiting factors. If you want to live in a certain area or things like that, then that could limit the type of job you're looking for. But theoretically, every single PA job is different, because each institution is going to have different surgeons and different pathologists who want different things and perform different surgeries. And so if you go work at a women and children's hospital, you're only going to have women and children's specimens. Whereas if you work at an academic medical center, you may get like a little bit of everything. If you work at a skin clinic, you may only get skins. And so it really just depends. All of the jobs are very unique and different. And so I personally think that you can find a job that fits your interest and your skill set, as long as you're willing to look for it and advocate for yourself and what you want. Now, the job outlook as far as job saturation, I don't foresee the profession becoming saturated. There are only 13 schools right now in the United States and Canada. There's 11 currently in the United States, and so there's not that many PA students graduating each year. And with the scope of practice of PAs constantly expanding, the PA role is becoming a little bit different. And so PAs are taking on different responsibilities and more responsibilities. And so even if all of the classic, let's say, grossing jobs for PAs, even if all of those became saturated, which I also don't think would happen, but if that did happen, there are still so many other things that you can do as a practicing pathologist assistant. You can go into teaching, you can go into lab management, among other things. And so there's a lot of different things that you can do. So I think the job outlook is absolutely fantastic, especially with the expanding role of the pathologist assistant and with the decreasing number of people or physicians going into pathology. So there is a physician shortage in pathology, and I personally think that that just means that pathologist assistants are going to have more room to expand their scope of practice. I get a lot of questions about the role of the pathologist assistant in diagnosis. So the final diagnosis for a case is rendered by the pathologist. But with that being said, PAs do play a very important role in diagnosis. So some of the differences between pathologist and pathologist assistant is what they're doing. So pathologist assistants typically will be dissecting specimens and using gross analysis and evaluation skills along with clinical reasoning and diagnostic reasoning to then determine what sections to submit. And those sections are then made into microscopic slides that will go to the pathologist. So the pathologist looks at the slides to render the diagnosis and also uses the gross pathology report from the PA and things like measurements or other pertinent things that we mention in our report, and they would use those to then come up with the final diagnosis as well as the slides. So the gross report is done by us if it's a PA grossing the case, and that is a very important part of the diagnosis. But also think about how those slides are made. So whatever you are sectioning on the specimen is what the pathologist gets to see under the microscope. So if you take a really good quality section, or if you take a really poor quality section, that's what the pathologist has to look at. If you forget to take a section of something, or if you are dissecting a specimen and you miss something, then if you miss it, you're not going to section it. And if you don't section it, it won't be made into a microscope or microscopic slide. So in that respect, PAs do play a very large role in diagnosis, because whatever the pathologist is seeing under the microscope is what the pathologist assistant gave them. So while we aren't directly making the diagnosis ourselves, the role of the PA is very important in that final diagnosis. And then the pathology report, in addition to those sections, some people say that we function as like the eyes and the hands of the pathologist, in that we are seeing the gross specimen, we are dissecting that gross specimen, and we are submitting the sections. And so at a lot of institutions, the pathologist won't see that specimen at all grossly. They will only see the slides and the gross report. And so if we forget to mention something, or if we describe something incorrectly, or if we measure something incorrectly, that can play a huge role in the final diagnosis. So an example, staging of a malignant case can really depend on staging, or can really depend on size of a tumor. So for example, some tumors, their stage is based on size, some it's based on the extent of invasion, but a lot of them are based on size. So say just a simple act of measurement. You take a ruler and you're measuring a tumor. If you measure something as 1.9 centimeters, instead of 2.1 centimeters, that could be a completely different stage. And then that patient may receive a completely different treatment and have a completely different prognosis just based on that one little measurement that you take at the gross bench. And so because that pathologist is not seeing that specimen and can't measure that themselves because they're not with the specimen, that measurement that you submit can entirely determine the staging and therefore the treatment and prognosis of that patient. So while it is not our final diagnosis, the role of the PA is very important. Now, another thing that people ask is, will PAs ever be able to sign out cases and have a more diagnostic role in pathology? And I don't know, I don't have a good answer to that, but I can tell you that some PAs are already starting to screen slides for pathologists, kind of similar to how residents screen slides and then come up with a preliminary diagnosis, and then the pathologist will sign off on it. So at some institutions, pathologist assistants are actually starting to do that, where they'll go through the slides and come up with a preliminary, diagnosis and report, and then the pathologist will either confirm it or update it. And so it is starting to happen, and I can easily see that expanding, but I don't know if they will ever be able to sign out cases officially. Just like a physician assistant, at the end of the day, they still have a physician name on everything as well. So it may come to kind of like how we do the grossing, where we are responsible for the grossing and it's our gross report, but at the end of the day, it's the pathologist's name on it, even if they didn't see that specimen themselves. So it may eventually come to be something similar where, as a PA, you're screening all the slides and you come up with your diagnosis, and the pathologist trusts you and would just let you do your diagnosis, but at the end of the day, it would still be their name on the report. So that may happen one day, who knows? It is starting to trickle out at various institutions, so we'll see what happens with that. In addition to the job opportunities questions that I get some questions about what types of facilities you can work at as a PA. And so this, as kind of the theme for all my answers, is it depends. And that's, in my opinion, one of the best parts about being a PA is there are so many different opportunities, so you're never going to get sick of your job. And if you do, you can always switch to a different PA job that does different things. So the types of facilities you can work at, it ranges, the classic example would be either like a private pathology lab or hospital, or an academic pathology lab or hospital. But there's other variants of that as well. So within academic medicine, you can work at, a smaller academic center. You can work at a huge academic center. You can work at an academic center that maybe other specialties have residents, but pathology might not have residents. You can work somewhere where you have tons of residents and you're responsible for training them and working with them. You can work at a private lab or hospital that is entirely private, or you can work at a hospital that is not a private hospital but maybe has like a private pathology group that they contract out to do the lab work. And then in addition to just academics versus private, you can work in other settings such as forensics. You can work in research, whether it is like basic science research or educational research or like biobanking type of research. Some PAs can work at biobanking facilities where they can manage the biobank lab or run the various biobanking protocols and all of that. So it just kind of depends. You can also work in management roles, whether it's in private labs or academic labs. You can also work at an external like research facility. So say you want to go work at like a primate center that does a bunch of research, you are qualified to do that as well. So you can work in a wide variety of facilities. But again, it just kind of depends on what exactly you're looking for.